Thank you, Greg, and I know just which bank to deposit that into. And I'm going to hold on to it to make sure. First of all, I'd like to thank you, Greg, and all the trustees of the Harold Alfond Foundation for all that you have done to make this day possible. The simple fact is, we wouldn't be here today if it were not for the extreme generosity of the Alfond family and the foundation. The impact of your contribution will be felt in this area for generations to come. So thank you for that. It is my privilege to chair the capital campaign for the new regional hospital and the Thayer Comprehensive Outpatient Center. Greg is right. The early response from the community to this campaign has been simply amazing. We began the campaign last fall with a goal of $10 million. By the time we launched the campaign publicly in June, we had already amassed an astounding $5.5 million in pledges. And yes, Greg, we will finish the job. We had early enthusiastic support from many pillars in our community. People like the wonderful Elsie Viles at age 97, who has named the gardens of the new hospital as she did for the cancer center right next door. People like Charlie and Nancy Schumann, who are naming the nursery. People like Linda Gagne and her brother Pete of Gagne & Son, who are honoring their parents. Companies like Pine State Trading and Augusta Fuel Company, and many, many others, including my own employer, Kennebec Savings Bank, which is naming the lobby. We thank all of our lead donors, and we look forward to recognizing their generosity in our new fabulous medical center. The people of MaineGeneral are also stepping up in a big way. The doctors, nurses, and employees of MaineGeneral have pledged an incredible total of $1.7 million in support of this campaign. And I was told that earlier today they have reached a new record of in excess of 50% participation by the employees of MaineGeneral. And I'm told if they get just a little bit further to 51%, there will be some pies and some faces on the senior management team of MaineGeneral. So I implore the employees of MaineGeneral to step forward a little bit further and get to 51%, because I would enjoy seeing that chart. Yeah. All told, we have gathered $5.9 million towards our goal of $10 million in less than 1 year. In the next 2 weeks, thousands of area households, including many of yours, will receive invitations to join the campaign, and next month, hundreds of people will come together for the Walk for Hope to raise funds for the new Women's Imaging and Breast Care Center at the new hospital. I cannot think of a more powerful legacy for all of us to leave our children and our grandchildren than the gift of health. With this new hospital, we do just that. I invite you now to share with me a vision of what our collective future will look like. Please watch the monitors.
I'm happy to narrate this visualization a little bit if I can see it. We're moving toward the front entrance. What we're seeing now is we're wrapping around the inpatient wings, which are at the north end of the hospital. We're standing now in the staff parking area, looking at the staff entrance. We're moving around to the highway side of the building, where we have the service side of our building, the loading dock. Now we're seeing the ambulance entrance. Now we're moving around to the south end of the building, where we see the walk-in entrance to the emergency department. Now we've got the conference center here with the conference center entrance and the front entry canopy. We're now wrapping around to the terrace where we have our cafeteria. We're looking at the outpatient office building and our spiritual building. The entrance to our rehab inpatient unit. We're standing in the parking lot looking down at the cafeteria terrace. Another view of our pond. And we're seeing the therapeutic rehab garden here. We're in the front parking lot where the handicap parking will be. This is the approach as you enter the building. There's a drive-under canopy where we'll have valet parking. And then the front door. Now we're approaching the long and winding road from Old Belgrade Road, closer in towards the front door. This is the north end of the hospital. Now we're in the staff parking lot. This is the view from the highway. And then finally the aerial. And in 2.5 years, we won't need to rely on the computer. We'll have it here for you.
Again, thank you all for taking part in our celebration today. We have some light refreshments following our presentation, so please stay and help yourself. As Greg was so gracious to invite the construction crew in under the tent, you'll notice that they're all here with us at this point. This is only a fraction of the workers who will be here over the next several months. In just a moment, I'm going to signal the crew who will resume driving the piles that signal the start of a new era in healthcare. We are truly on our way. I want to thank everybody who helped put this event together. It takes an awful lot of work, and it's a wonderful, wonderful morning. So in the same spirit of partnership and collaboration that has brought us here today, and I'm going to look to Bertie Cates to give me some help here. On the count of 3, please everyone join me in shouting out, "Operator, drive that pile." So, remember, it's "Operator, drive that pile." Are you ready? 1, 2, 3. Operator, drive that pile. Thank you all. Thank you all for coming. Thanks to all our speakers. Enjoy this wonderful, wonderful day and this wonderful, wonderful project. Thank you very much for joining us.